Wonderful. Well, hello, everyone. I hope you can hear me okay. It's a shame to not be able to see your faces because I'm sure we have a lot of old friends joining us today. So thank you so much for being here. My name is Jessica Perlo. I'm a director at the Institute for Healthcare Improvement, and my colleagues are going to introduce themselves in just a moment. But I want to thank you, and I want to welcome you to our session talking about joy and well-being during and post the pandemic. And we're going to share some lessons from the field with you today. Our objectives are to communicate the value of increasing joy and well-being at your organization. It might not seem like a priority all of the time, but we believe it is. And so we're going to talk a little bit about why we think that is. We're going to talk about some changes that Royal Free Hospital made during the pandemic and prior to it. And then we'll talk about some interventions that you can test at your institutions to assure that staff are feeling meaning and choice and camaraderie and equity in the midst of all that they're holding. Thank you for saying hi in the chat too. It's lovely and welcome. So I'm sure many of you are familiar with IHI by now, but you might not know that one of the things we do is we use improvement science to partner with organizations to identify and address barriers to well-being and joy in work and reconnect people to their meaning and purpose in their work. And we do this in alignment with our values of love, courage, equity, and trust. My slides are being a little slow. Hopefully they're advancing for you all. Okay, what is joy in work? Well, when I say joy, sometimes people cringe. And I understand that. It can feel like a chasm between our daily experience and one of joy, particularly during a pandemic. So, but joy is inherent in medicine. It's inherent in healthcare and in being of service and having the privilege of contributing to others' health and well-being. And not all industries have that. So when I'm talking about joy, I'm talking about that sense of satisfaction and fulfillment that comes from meaningful work. But you're each experts in your own joy. So I'm going to ask you to please chat in when I'm talking. What does joy in work mean to you? And what does a good day look like for you and your team? So go ahead and chat that in. You should be able to open the chat on the left-hand side of your screen. And I'm asking you to do this also just to give ourselves this moment to reflect on something positive. As human beings, we're hardwired to have a negativity bias. And so we have to be intentional and cultivate the positive. So this is just a little exercise to help us turn up the positive right now. The other reason we were very deliberate in choosing the phrase joy in work is because it's actually not a new phrase. It harkens back to W. Edward Deming, one of the forefathers of improvement, who best codified the science of our understanding of systems. And to Deming, joy was the product of well-designed systems and good QI work. And it was management's aim or goal to assure that everyone is experiencing joy in their work. But of course, joy is more than the absence of burnout. So Derek Feely and Don Berwick have been champions for this work for a long time. And they urged us, just as Aaron Antonovsky, the American-Israeli medical sociologist, identified health as more than the absence of disease, so too joy is more than the absence of burnout. So burnout, which we talk so much about, it's necessary to tackle, but it's not sufficient to produce joy and well-being. And so we're talking about a positive, proactive, productive thing rather than just the absence of negative factors. And so to do this, we created the framework you're looking at here. You can read about this in our white paper. I'll chat in a link. But it basically just walks folks through a few steps to get from where we are to more good days. And the steps are not overly complicated. In a lot of ways, they're intuitive. This is the how of the work. And it turns out that with joy and well-being, it's just as important as what we do. But we start with asking people what matters to them, which many of you, I'm sure, are very familiar with by now. But it's a good excuse to have a new conversation with an old colleague about why they got into this work to begin with and to reflect and communicate ourselves on our values. So it's trying to uncover why people care. And the second step is then we start to identify the pebbles in the shoes or the things that are getting in the way. And then we use improvement science. We commit to a distributed leadership so that we're giving people an opportunity to lead that might not ordinarily. So in step 3, we're talking about shared responsibility at all levels, so that the people with the problem can become the authors of its solution. And as I said, using improvement science, we don't have to reinvent the whole system right off the bat. We can test changes slowly and at a smaller scale to improve over time. So I'm not going to get into the what of the work. My colleagues are going to do that in just a moment. But this is the second part of the framework and includes many of the factors that we need to address at all levels. And I'll skip right ahead. But as I mentioned, I'll chat in a link to the white paper if you want to read more. When we started this work, we realized, though, that new mental models were needed, that there's a lot of old ways of thinking about well-being, and that usually comes in the flavor of, we already have a wellness program, we've given everyone yoga mats, or, this is a millennial problem. We heard that a lot. In my day, we didn't have to, worry about this sort of thing. Or that it's only one team or department's responsibility to take care of it, or that it's all about turnover. I mean, there is an ROI for this work. There's cost associated with burnout, but it's also linked to better outcomes and better patient care. And it's really about not just an individual shortcoming, but systems that we can design to make sure that people are experiencing more good days. One more slide before I turn it over to my colleagues. I know that a lot of the factors that the pandemic has posed for us are contributing to burnout. It's not new, it's just exacerbated by the pandemic. So when our job demands are greater than the resources we have to get the work done, when things are out of our control, we have little autonomy. And of course, this is happening for a sustained period of time. This is a long pandemic too. So I know the conditions are not favorable for this work, and we have an opportunity to focus on what we know works, to better systems and better conditions for the work to happen. So with that, I will hand it over to Susan.
Oh, thank you so much, Jess. Great intro. And what's really exciting about the next half, hear about how all this translates into the real world, and we're going to hear first from Kate and then from Karen. But just to quickly introduce myself, I'm Susan Hannah. I'm a Senior Director with IHI based in the Europe region, living in the UK, and I'm delighted that I'm part of the faculty for Joy and Work in IHI, and it's been really exciting to get involved in that work. And I've also had the privilege of working closely with Kate and Karen in recent months. And Kate, I'd love to just hear you introduce yourself and tell us a little bit about your day-to-day role, and then tell us a little bit about what that's felt like during the pandemic.
Thank you, Susan, and it's a real joy to be here as well. Like everyone, I'm sad I can't see people's faces, but it's lovely to see all the different countries that are represented today. The chat's been lovely to watch. My name's Kate Slemick. I'm the Chief Executive of the Royal Free Hospital, which is part of the Royal Free London Group. We have a group of hospitals, of which the Royal Free is the largest in the group. We serve a population of about 1.6 million. We have 10,000 staff across the group. About 6,000 of those are at the Royal Free, and turnover in the region of £1 billion. So we're a relatively large organisation. I've been a Chief Operating Officer for many, many years, probably about 12, 13. I think I was the longest standing Chief Operating Officer in London. And for the last 3 years, I've been the Chief Executive of the Royal Free, and it's been a real privilege, actually. But during the sort of COVID period, I stepped up into being the emergency planning lead, to sort of lead the COVID response for the Royal Free London, and link very closely with our sector in London, the North Central sector of London, so a bit in the middle, when we work with other trusts across the area in terms of how we responded to COVID.
Wow, that's amazing, Kate. And I mean, what a lot of experience you brought to that role. That's wonderful. I wonder, could you tell us a little bit about what's been your connection with Joy and Work and what matters to you?
So as an organisation, we've sort of become really familiar with joy in work and what matters to you over the last few years. We've been running days, joy in work and what matters to you days since about 2017. We used to do it as a day, a year, which of course is really not what it's about, is it? We've moved on a lot since those days, and we now very much have it as the fabric of what we ask people and how we work. So working both with patients and staff about what matters to them. So change from a once-a-year event to be very, very sort of in our DNA and the way of doing things. And I've got to thank Karen a lot for that. And Karen's going to speak in a moment as well. So over the last 18 months, it's become much more embedded in the way we think and the way we work within the organisation. And then sort of culminating last summer, we stepped up a Joy in Work collaboration. See the sort of the chart here in front of you that we sort of work through the key components for how we improve staff experience and well-being, such an important thing before COVID, even more important now in a way. So lovely collaborative, bringing teams together, and we had 12 Joy in Work teams taking part. And actually we're halfway through this collaborative when the pandemic hit. But we've got some fantastic examples. Some of you may have heard of, I think even our ICU project that really drove down, and by approaching joy in work and asking what matters to you, the team came up with a number of things that would make a real difference and really reduce the turnover in our ICU department, which actually took us into a really good place going into COVID. And it's been really good work done on day surgery that I'm sure we showcased over time. So fantastic way to bring staff together and to talk about the things that really do matter to them and actually bring joy in their everyday work. So it's something that is very much part of what we do now, rather than it just being a once-a-year activity.
Yeah, and it's been an absolute privilege working with your teams on Joy in Work over this past year. And we were so impressed with the work that was happening on the run up to the pandemic hitting and kind of stopping us in our tracks a little bit. But could you describe a little bit more about what happened in the organisation during that first surge in the spring?
Yeah, thank you, Susan. So it's been quite interesting thinking back to that time, which in some ways feels like a long time ago, but in many ways wasn't that long ago. So I'm going to pop this slide up, which really sort of, for us, exemplified the experience that it felt, a bit like sort of climbing up Everest. This is shows you the data. And if you stretch this data out, you'll see there's a massive spike around the time of March to May of which really exemplified the sort of number of COVID patients we had in the hospital. For the Royal Free, it started quite early because one of the things that we do very well is we've got a high-level infectious diseases unit, and we took in the second patient in the UK. And I say patient, they were very well elite skier. So in those days, it was when we were trying to contain the virus. It seems extraordinary now that we're ever trying to do that. We're trying to stop it spreading. And we admitted, as I said, second patient on the 9th of February. So it's quite early on in the whole process. And at that time, I remember us knowing very little about COVID, what it was, what it meant, bringing staff together, talking about the importance of washing hands, distancing. Again, we were still quite new to all of that. There was a lot of fear and concern because people didn't know what was coming. But it became very clear in March that it really was coming at us like a train. It felt a bit surreal in February. In March, we could see the numbers rising daily. So around the 2nd of March, we stepped up our COVID Gold Commands. I stepped into the accountable officer role, and we then moved very quickly into 7 days a week in executive level with a structure in place, key enabling work streams to make sure we were supporting staff in decision making, very much pushing down the leadership decision making into the organisation, but trying to take away or support the leaders in the decisions they have to make and take away some of the worries and concerns. You'll see on 21st of March, we stopped all planned surgery, suspended that. And then on the 23rd of March, lockdown began. So interesting, so we've got lockdown, haven't we, starting in the UK today. I have to say it's a very different lockdown experience, the one in March, because I travelled in to get today on the tube and it was very full and busy. Back there in March, it was literally, there was nobody anywhere. I travelled on empty trains, empty tubes, empty streets. So many of you in the UK will remember that, and I'm sure in your own countries will remember that as well. So we had our real super surge, I think it's probably fair to say, around we extended our ICU into areas that we would never normally manage ICU patients around the 30th of March. And we always talk about an Easter that we never had, because everybody worked through the Easter weekend at the Royal Free and in the NHS, because we were at our height at that time. But so really the observations, Susan, in the early days, a lot of fear, a lot of uncertainty, concern for people concerned about themselves, people concerned about their families and their patients, and frustration and fear, and that sort of constant climbing that mountain in a way, constant change. Every time we had to change things, it caused more anxiety, and then things settled down for probably about a 3-day cycle and then change again. And it was like running a major incident for weeks and weeks rather than a day or 2 days. So a real interesting challenge that many people went through.
Absolutely. And I mean, this slide exemplifies that perfectly, just the huge challenge that you face. And I'm really curious then, Kate, to think about and learn a little bit from you just very quickly before we hand over to Karen, about how you listened to staff, thought about what mattered to staff during COVID, and what was as part of your role as a senior leader in the organisation. How did you do that?
So obviously listening to staff it was really important that we sort of listen to people's anxieties and concerns. And we actually just very early on, and again with Karen's help, and she'll go into a bit more detail, we asked people what mattered to them. So this was undertaken in early April. So trying to, what matters to you now, what's working well for you, what are your biggest worries, and how can the organisation support you? And you can see on this sort of chart, it exemplifies really nicely. It's around safety. PPE was an enormous issue. Morale, people wanting to feel like they were making a difference. These are the things, and safety, these are the things that are really dear to people's hearts. The worries were around getting COVID-19, actually understanding what it was and what it meant. There was a lot of anxiety about that at the beginning, particularly as we were opening wards up and turning them into COVID wards. We had some people who just didn't want to work on a COVID ward, but actually at its height, all our wards had COVID patients on them. So also, worried about family and making sure that they were safe, wondering how long this was going to continue. And actually, it's funny looking at this now. We're not funny. It's the irony is there, because everyone thought it was going to come to an end, and we're still there, aren't we? We're still in it. It's still happening. Thinking about what was working for people, people did feel supported by the Royal Free, and I'm going to talk very briefly about that, and Karen will go into more detail. Team spirit, having a rest on days of compassion, working together, the things that really matter to people. And then how did people feel best supported? And that was the teamwork that came out regularly, supporting each other, talking to us. So the communication is always so important. And I guess what we really focus on as an executive team and as an organisation is how can we take away, we needed people to do the work and to look after the patients, but we needed to take away other pressures. And for those of you in the UK, you'll remember in March, the shops were empty. There wasn't any loo roll, there wasn't any food, because people were bulk buying in fear of the lockdown. So, how do we make people's lives easier? How do we make sure staff feel cared for so they can do their job without those worries? So a lot of that revolved around access to food, making sure that food was available, accommodation was available. Some people wanted to move away from their families, people who were at risk, and live nearer to work. That was an amazing offer, and we wanted to make that easy for people if that's what they wanted to do. Parking, shop, Karen again will talk a bit about, helping people get to access to the goods that they needed when they went home because they didn't have time to go shopping. Mental health and wellbeing support, obviously absolutely critical, enabling people to talk and work things through. Although in the moment, lots of people didn't want to do that. We continue with that now. And providing quick answers and communicating. So we set up advice lines. We made sure there was we had an incident centre, because actually lots of big questions were initially going to our infectious diseases team, and they weren't coping with that. So we had a conduit and a route whereby people could ask anything and ring up a line and get an answer and get things resolved.
Great.
So really thinking about all of those things, I think, help people feel supported and loved and able to get on with their jobs.
Yeah, wonderful, Kate. My goodness, wonderful. And to hear you say, to make people feel loved is such an important thing, isn't it? When you think about creating some level of satisfaction and joy in work. Wow, really important. Well, let's hand over now to Karen, because Karen has been in amongst these teams from the start as an improvement coach who got involved in the Joy and Work Collaborative. And then during the surge, Karen took on a significant role in supporting staff wellbeing on site and is now an improvement advisor on one of the sites. So Karen, please talk us through some of your experiences during that surge.
Thank you, Susan. Thank you. And thank you, Kate. Yes, as you said, I was a coach before COVID for one of the Joy and Work projects. And I have to say that when the pandemic started, I did actually have to ask myself, is it still relevant? Is actually asking what matters? Is Joy and Work still relevant? Is it still a relevant question to be asking? Is it still something that we should be seeking after? Because we had, did it still make sense? We had a lot of staff who were really worried, who were scared, and it felt very far from joy, if I'm to be honest with you. And I'd been a real advocate of Joy and Work before the pandemic, but I did question, was it still relevant? Our whole Joy and Work programme was paused, suddenly was cancelled. But I did really strongly believe in the power of what matters to you question, and still do. So I actually asked staff what mattered to them, and you can see here this was early April, and I didn't know what staff would say, and this is what they said. Actually, even in a time of crisis, they found some joy or satisfaction. Now, I didn't ask our 10,000 staff. I didn't ask everybody, but we did this now, and then we did this towards the end as well. And actually, the results were fairly similar. And we can see here that actually even in a time of crisis, there was still a significant amount of staff who could find some joy or satisfaction in the work, and they did also feel really supported by the organisation. So, next. There we go. So when I reflect back now about Joy and Work and what happened during the pandemic, I thought it'd be useful just to maybe pick out 4 areas from the wheel. So 4 of the factors that contribute to the Joy and Work wheel, and just really give some examples of the sort of things that I saw that worked in our organisation, and some of the factors that made that possible. So I'm going to take one at a time. So meaning and purpose, as Kate has explained, looking at our Everest mountain, we had a common goal, we had a common enemy, and a common priority, and we were all focused on one thing, which was the virus, and it was really uniting. There was great patient need, and there was a lot of suffering as well, and there was a lot of acknowledgement as well that there was a huge demand, and we didn't necessarily have all the answers. And so it did create a culture of testing, because we didn't know all the right things to do, and there was a cultural change in the organisation, I think, and I think there was something that the exec team did really well in allowing people to try new things and allowing a certain amount of failure as well, doing that. And there was something about climbing up that mountain. And something about how do we enable staff, as Kate was saying, to be able to climb up that mountain all together, and what can we take away? What can we enable staff to be? What can we help staff with to be able to make that possible? Interestingly, I think now reflecting, it was maybe slightly harder to come down the mountain when we had more than one priority, and maybe more difficult now again as we're carrying on with business as usual. And we all there. So I think so. Interestingly, in some ways, going up the mountain, as hard as it was and as tough as it was, from a meaning and purpose point of view, it really was very uniting for the organisation, I think. So looking at physiological and psychological safety, I mean, this is something that all over the world people will have recognised as being really critical to get the physical and psychological safety right. We, as an organisation, we tried really hard to communicate the facts daily and regularly. We listened to what people needed to hear. There were lots of different types of support, and physical safety was really, really high. When we started our Joy and Work Collaborative, and we asked people to rank on the wheel where they what was most important, physical safety wasn't very high a year ago, and now it's really high. It was really, really high in the beginning of the pandemic. And so one of the things that the organisation did to recognise this was they supported, or the charity supported our gown factory. So we had up the road in a town hall, we had hundreds of volunteers. You might notice some famous ones here who were making gowns and made 50,000 gowns in the end for our staff. And that is something about pulling together and actually recognising there was a need. And we became a hub for PPE in the area. And we never ran out. I think there were a few close calls at times, but we never ran out of PPE. And there's something about the organisation being able to provide and make sure that staff are really safe. This is one of my favourite photos. When I was walking around the wards at one point, I somehow became in charge of food and toiletries at one point, and managing donations. And I remember speaking to a member of the team, and I said, a nurse at the time, and she said, "It's great, thank you so much that you're bringing cakes and biscuits around, and that's what we're being donated. But what we really want is fruit and vegetables, because when we go home in the evening, there's no fruit and vegetables in the supermarkets, or we're having to queue for a really, really long time, and we really just want healthy food." And that's what mattered to her. And so we actually delivered. We had these boxes. This was our first delivery of these 250 boxes of fruit veg, and I remember taking these up, and literally you would have thought that we'd give them £1 million. They were so happy with having fresh fruit and vegetables. This was really early on. These guys hadn't seen fruit and veg for about 10 days, fresh fruit and veg, and so it was really special. It's a really special time, and but that's what mattered to these members of staff. My slides are being very slow. And when we at the end of the first wave, if we really ever had an end, we did ask staff how they felt. And how they felt supported, and food was a really big part of that. And the organisation had made free food in the canteen. When you asked people about what it was about the free food, it wasn't necessarily the fact that they were delighted not to pay for it, but it was the fact that they felt cared for by their organisation. The organisation had realised the stress that people were under and had done something quite extraordinary. So you'll see other things as well. So there's there's psychological safety, psychological and physical things here that have been addressed, and how the team felt supported. Autonomy and control. So I don't speak for all the 10,000 members of staff in the organisation at all, but when I was walking around, these are some of the things that people felt that they'd been given. They'd been given more freedom and trust in their roles. Lots of us were redeployed to do different things, and there was a real sense as well of flattening hierarchy, just getting on with things, doing what you thought was the right thing. Yes, we had supporting reporting lines, and that was really important. But there was something about what can we do? What can we do that's different? How can we break the rules? How can we be more imaginative? And for me personally, my role in this was an interesting one in the fact that we had a lot of staff who were really who were struggling to get food before or after the shifts and doing really long shifts. So as Kate mentioned, we set up this, we had a free supermarket that ran for 8 weeks, morning and evening to match the shift time, so before shifts and after shifts. And this was funded by our charity and kind donations from the community. And it mattered to staff because they could come, get their provisions for the day, and go home, or they could pick up something in the evening to feed their family. And this really mattered, and it particularly mattered at the beginning because it was hard to get food. But about 4 weeks in, I did another What Matters to You, because I do a lot of What Matters to You. And I went around and I asked staff who in this supermarket, why does it matter? And lots of people said it gives me time to rest. It means I'm really refreshed when I come in. They said, I feel loved by the organisation. I can pass that love on to my patients, and it really helps. And I had a few people say, actually, do you know what now? I can get food in the supermarket. I feel a bit uncomfortable coming to pick up free food. I'd like to give back. And so the next day we set up a food bank within the supermarket so people could take their 6 items and then they could redonate. And then we had vans going every week to food banks to take the food that staff had donated, because that is what mattered. Because what matters changes. It's not static. You have to keep asking what matters and to be really responsive. I think that is something that I've really learned. And what mattered then isn't the same as what matters now. We don't need a supermarket now, thank goodness. We don't need that now. We need other things. So then the last thing to say is about camaraderie and teamwork. And this is, again, one of my favourite photos, because I really think it shows how there was, this is a picture of a wall in intensive care, and this is at the Royal Free, and we've got them in other sites as well. And this was organised by Nima, who was a management trainee, and there was a blank wall, so staff who were working in intensive care and who had a huge amount of pressures would walk from one end of the corridor to the other, from the tea room where their lockers are into the intensive care unit, and it was a blank, bleak wall. And Sinead, one of the matrons, said, we need to do something about this and make it a bit more, do something to make it more pleasurable to walk down, to give it some meaning. And so a call went out to the community to say, could you send in pictures? Could your children draw pictures of whatever they like, and we'll put them on this wall. And with thanks to the charity, this is a brilliant, beautiful board now. And I just wanted to say there was such camaraderie with the community. It wasn't just camaraderie within the organisation. We really felt the community were behind us. And I know we had the clap, and that was brilliant as well. But there's something, and you visit this wall, and it's very moving to see this wall and see the response and see how people were really, really behind the organisation. So yeah, there's a wall here. There's another wall at Barnet as well. There's lots of walls in the organisation. And the other thing that lots of places in the Royal Free, lots of places in England connected with is Project Wingman. So we have people from the airline industry who were furloughed, who came and supported our staff, and they're still here today. They're still in the building supporting staff. They have training in having empathetic conversations and listening and managing difficult situations, and they are still here supporting our staff. So the camaraderie and the teamwork didn't just come from within, it came from outside as well. But just this is, there's a link here to a video that you're welcome to watch, and it takes place on the International Day of the Nurse, which was in June. And there's a lady here, Jane Moss, who wrote a song for our nurses, and it's all about how brilliant our nurses are. And we all got together when we were allowed to get together. We wouldn't be allowed to get together now, but in those days when we were allowed to get together, we sang this song to the nurses, and it's really worth a watch because you'll get a sense of the connectedness and the teamwork. I love the clapping at the end. It just goes on and on and on because we really pull together during this time. So I think it's really important. So in their own words, so this is what we asked staff after we come down the mountain. We said, what's gone well? In your own words, tell us. And you can see right there in the middle the teamwork. The thing that costs no money is teamwork, and it was so important. And the second thing that came out as the second strongest theme was senior management. They really felt they'd been supported by managers in the organisation. They felt they'd been heard and listened. And there's lots of other things that you can see. So you can see free food is important, but it's not as important as teamwork or of being supported by their managers. So I think on reflection, looking back, at the beginning I was thinking, is it still relevant in a pandemic? And I think it's even more so relevant now. And keeping asking staff what matters, not just once. What matters now isn't going to be, what mattered then isn't going to matter the same now. But it is really important to ask, listen, and do what matters for our staff if we want to help them get through what's going to be a hard next few weeks and months, hopefully not years. Thank you.
Brilliant. Thank you so much, Karen, Kate, and Susan. Some really great questions happening in the chat, which thankfully folks have been responding to in real time. But I do have a question for you, Kate and Karen. As you've entered the second lockdown and continues, what has changed about how you're approaching this work now? How are you thinking about it differently at all? And how frequently are you having these what matters conversations?
So shall I start, Karen, and I'll hand over to you? I mean, I think these are so important. I think, do you know, it feels tougher now than it did before in a way. Staff are really tired. I'm sure I've been reading the chat, and I think we've all in a very similar place. And I guess the difference now to before is that, in a way, I'm quite glad we had our pandemic at the beginning. I think there are other parts of this country that are having it now. And I really don't envy them. We're trying to keep everything else going as well, and there's a fear about going into it again. So we are absolutely continuing the conversation. Sometimes it's a bit harder to have them, but but that makes it even more important that we do. And Karen and I were talking about this the other day about sort of really sort of going back out there, talking to staff. We've had a whole, which we continue to do throughout, but we've had a whole piece of work done around the well-being, what else we need to put in place to support people over these next few months. Karen, what would you like to say about that?
Yeah, I agree. I think it's harder now. It feels harder now because we've got so many different priorities going on. So I think it's hard, and I think people are really tired as well. You know, it's you know, everyone was encouraged to have holidays, but lots of people couldn't have holidays. They couldn't have time away, or their children weren't in school. So it didn't feel like people had a really good break, to be honest with you. So I think it's really hard. I mean, I think we've there are lots more things set up now. So at the very beginning of it was slightly on the fly. We were just trying to do things as quickly as we could to step things up. And now I do think that it's much more organised. The offer now from the organisation, it's much clearer what the offer is and what the support is. And our charity has been great. And I think actually it's the psychological PPE now, which is, I think, is more important than that we have the physical PPE. And that is, I'm not saying that isn't hard to wear. It's hard to wear, and it is exhausting for staff to be in. But it doesn't seem to be the same sort of fear that there was at the very beginning when we didn't know what we should be wearing and did we have enough of the right kit. And now it feels like, you know, the biggest priorities for staff is to feel listened to and heard, and that we and actually the organisation are really trying to invest in doing that.
Yeah. I just chatted in a link to a psychological PPE resource, because we're often not doing exactly what you just described, Karen, which is donning and doffing the things we need for our own mental health.
Yeah.
Another question here for you both is, given the massive size of Royal Free, Kate, how did you even begin to think about and connect with so many of the individuals in the workforce?
So that is always a bit of a challenge. And in the height of COVID, when you weren't quite sure where you were able to go and not go, I think that became more of a challenge. We did a lot of communications in terms of video communications. I did walk around the organisation because I continue to do that. Karen and I did quite a lot of doing that together at its height, delivering things, taking that as an opportunity to go and see staff and see how they were. And just to sort of the usual way to try and sort of find mechanisms of speaking directly to staff, wandering around, having some set pieces where people, in fact now one of the good things about COVID is actually people are much more used to dialing in and being able to see each other, and that's been quite a useful mechanism for bringing big groups of people together at a time when you can't bring big groups of people together into a room. So continuing with all of that, weekly discussions. We have daily calls with sort of key senior leaders in the organisation. We've continued that since the sort of first phase, because that's really helped people remain connected into what's going on and being able to influence what's going on as well. So it's a constant challenge. You constantly have to think about how you do that, but you do need to walk about, you do need to be visible, you do need to be available on these sorts of things to be able to have people can ask you questions and share information. So trying to do a lot of that. And I know Karen absolutely does the same, don't you, Karen?
Yeah. And I think it's just also worth saying that we had the Joy and Work Collaborative that we mentioned before. Actually, the teams who'd done that before, who'd started asking their staff what mattered, and had started asking, listening and doing, and had learnt about what the pebbles in their shoes were. A lot of these teams were much better prepared for what was happening, or they were in the right mindset. So I think we've got, some a feedback from those teams saying actually we were it really helped us to really realise that actually looking after our staff is really, really important. And that they were glad to be in a collaborative and didn't know COVID was coming, but it helped equip them to deal with the pandemic. Give them some tools. Yeah,
that's great. Thank you so much. And I'm just picking up on another question that's come in from Claire, which is a really great one. So we heard you talk, Karen, about the really great effort and work that went into capturing the views of staff during COVID. But thinking about joy in work generally, there's a question here about how you measure joy in work and what matters to you. And I know you've done a lot of work around this. Would you like to share some of your thoughts there?
Yeah, so I mean, in the collaborative, we asked teams decided how they wanted to measure that themselves. So some teams did good day, bad day measures. You know, if you had a good day, we were as basic as putting a counter in a like a Connect 4 game or a box. We're as basic as that. We also, over time, have developed some surveys. And I see some people on the chat like Clifford and Catherine and others who have been involved in that. And we have, and some of the data that we collected on our post-COVID debrief. So we had, I think over maybe 1,200 staff, Kate, filled that in, didn't they? So we've got better at using surveys and asking people what matters. But we have to. I think there's a trap to fall into, keep asking what matters and not to listen and do and to follow through. So there is however you ask, however you measure it, you have to have the leadership buy-in and the team buy-in to actually want to do something about it. And often they're not big things. Often they're small things. Often they're things that don't cost any money. A lot of it is about putting teams together, communicating more effectively, feeling appreciated, feeling recognised. And there are little things you can do. I was speaking to the senior matron in the ICU on Monday on his day off. I had a chat with him, and every day now they're asking staff, what matters, what you're worried about, how can I support you, today, and then they're doing that every day, and that makes a massive difference for teams. So sometimes it's just small questions. Some of the work we did here was quite big and involved a lot of people. Supermarket had 30 volunteers and a whole rec club staff running it. Some of the stuff is big, but a lot of the stuff that really mattered, the teamwork stuff, is can be done in teams, and it doesn't cost any money. It's just about reframing some of your question and being open and wanting to listen and wanting to improve the working life of your staff.
Wonderful. Thank you so much, Karen. And a lot of what you were just sharing is the approach of using the data you already have. So someone mentioned Gallup in the chat. Gallup, Press Ganey, Mini-Z, MBI, whatever existing staff satisfaction survey data you already have, and then supplementing that with something a little bit more frequent for the purpose of improvement work. And so what Karen just described were various ways you can do this with a good day measure. There are apps that help you do this. Happy Force, Improve Well is another product. I'm not endorsing any of these, but I've heard folks using them to various degrees of success. So check them out. Thank you to our panelists. We're hoping to use just a moment to ask you to make a commitment to do something by next Tuesday, to act on what you've heard today. So if you're willing to chat in, what's resonating for you about what our speakers shared today? Where might you take action in your own organization? And just a commitment you might make to begin to co-produce joy and well-being by next Tuesday. And to our end, we want to make a commitment to you as well, that this is not the end of the conversation. We've worked with Royal Free and are very grateful for the work they've done. You can work with us as well or connect just with each other. There's a website here, ihi.org/joy, that will offer you various ways to stay connected. So we have the white paper that I mentioned, a virtual course. There's an 18-month collaborative, which is similar to what Royal Free did, which is a commitment system-wide to transformation. So we're here to support you and your work. I want to say thank you to Kate, Karen, and Susan and all of you for making the time to be here to talk about this topic and to take care of one another during this pandemic. Thank you so much.
Thank you.
Thank you.